Dear students, welcome back. In the previous session, we have discussed about subtalar joint function. Now in this session, we are going to discuss about another joints present in the foot and ankle complex is the transverse tarsal joint. The transverse tarsal joint, also called as mid-tarsal joint, okay, which is a compound joint formed by talonavicular and calcaneo cuboid joints. The two joints together present an S-shaped joint line. So here you can find the S-shaped joint line that transects the foot horizontally, dividing the hind foot and midfoot and forefoot. Okay, the navicular and the cuboid bones are considered in essence as immobile. So in weight bearing, especially in weight bearing. So the navicular and cuboid bones, only bones, the navicular and cuboid bones are considered to be immobile in the weight bearing foot. Okay. Transverse tarsal joint motion therefore is often considered to be the motion of the talus and the calcaneus on the relatively fixed navicular and the cuboid unit. Okay, on the fixed navicular cuboid unit. Okay, motions at the compound transverse tarsal joint, which is more complex than the relatively simple joint line, and this complex movements occurs simultaneously with the motion at the subtalar joint. Okay, now we will see the transverse tarsal joint structure. Yes. So here in the compound we have discussed that it is a compound joint. So what are the joints forms the transverse tarsal joint? One is the talonavicular and calcaneo cuboid. Now we will see the talonavicular joint. The proximal portion of the talonavicular articulation is formed by the anterior part of the head of the talus, and the distal portion is formed by the articulation by the concave posterior aspect of the navicular bone. This is the navicular bone, and here we can have this posterior aspect of the navicular bone, which is concave. Okay, and we have already discussed that the talar head articulates inferiorly with the anterior and medial facets of the calcaneum. Okay, so a single joint capsule encompasses the talonavicular joint as well as the anterior and medial facets of the subtalar joint. This one also we have already discussed in the subtalar joint. Okay, because in the subtalar joint is having a large posterior articulation, whereas it is having a smaller portion of articulation which includes anterior and medial articulations with that of the calcaneum, and this smaller portion of the articulation of the subtalar joint as well as the talonavicular joint is having a single joint capsule. Okay, now what are the structures which are going to reinforce this joint capsule? Okay, so the inferior aspect of the joint capsule is formed by the plantar calcaneo navicular ligament. Okay, so if here the talus is removed, so here you can find the concavity of the navicular bone, and also we can find the calcaneum here. So Thus, inferior aspect of the joint capsule is formed by the plantar calcaneo-navicular ligament, which is called as spring ligament. So, this ligament spans the gap between the calcaneum and navicular below the talar head. Okay, the capsule is reinforced medially by the deltoid ligament, okay, and laterally by the bifurcate ligaments. Okay, so by seeing all these relationships, the large convexity of the head of the talus can be considered as a ball that received by the large socket formed anteriorly by the concavity of the navicular bone forms the socket here. Okay, and inferiorly by the concavities of the anterior and medial calcaneal facets and by the plantar calcaneo-navicular ligament, and medially by the deltoid ligament and laterally by the bifurcate ligaments. Okay, so these are the ligaments which give support to the talonavicular joint. If you see the anatomical structure, so here we can't see only the articulations of the navicular with the talus. It is also related with the calcaneum also, because the talus is also articulating with the calcaneum, and this navicular and the calcaneum also having a ligamentous relationship. So because of this linkages, anatomical and functional linkages of the talus with that of the calcaneum, forming a compound term called as talocalcaneo-navicular joint. So this talocalcaneo-navicular joint as well as the talonavicular joint, both are same. Okay, now if you see the importance of the spring ligament, the spring ligament is a triangular sheet of ligamentous connective tissue arising from the sustentaculum tali of the calcaneum and inserting on the inferior aspect of the navicular bone. Okay, the spring ligament is also continuous medially, okay, continuous medially by the deltoid ligament and laterally by the bifurcate ligament. Some of the evidence suggests that the spring ligament is composed of three components. Okay, these three components are, one is the superomedial, okay, superomedial and medioplantar oblique and inferoplantar longitudinal bands are present in the spring ligament. So although this spring ligament is present below the talus only, okay, and these three bands are present in the spring ligament. Okay, so the spring ligament plays an important role in supporting the head of the talus and talonavicular joint, as well as one of the main static and passive stabilizers of the medial longitudinal arch of the foot. Okay, and so because of this attachments with that of navicular and calcaneum, which is also related to the subtalar joint. So because of this anatomical relationship, so the talonavicular joint and the subtalar joint are linked in the weight bearing foot. So weight bearing dorsiflexion, plantar flexion and abduction, adduction of the talus on the calcaneum during subtalar supination pronation, which is necessarily involves simultaneous movement of the head of the talus on a relatively fixed talonavicular bone. In weight bearing, therefore, the talonavicular joint and subtalar joint are both anatomically and functionally related. And the ligaments of the talonavicular joint also include the ligaments which are giving support to the subtalar joint also. The main ligaments are spring and bifurcate ligaments. So along with these two ligaments, this talonavicular joint is also getting support from the dorsal talonavicular ligament and by the subtalar joint ligaments like medial collateral ligament, lateral collateral ligament, the inferior extensor retinacular structures, and the cervical and interosseous talocalcaneal ligaments. Okay, so this is about the talonavicular joint. Now we will see the calcaneo-cuboid joint. Okay, so this calcaneo-cuboid joint is formed proximally by the anterior calcaneus, okay, and distally by the posterior cuboid bone. If you see the articulations here, so the proximal anterior surface of the calcaneum, which is entirely covered by an obliquely set concavo-convex facet, distally the posterior surface of the cuboid bearing a smooth triangular concavo-convex facets. Okay, this concavo-convex shapes we can see both side to side as well as top to bottom. So the reciprocal shape makes available motion at the calcaneo-cuboid joint which are more restricted than that of the ball and socket joint in the talonavicular joint. Okay, so this calcaneo-cuboid joint is also linked in the weight bearing of the subtalar joint like talonavicular joint. In weight bearing, subtalar supination, pronation and inversion and eversion of the calcaneum causes to move simultaneously on a relatively fixed cuboid bone. So in this talonavicular, the navicular bone is fixed and the talus is moving in weight bearing. So in the weight bearing, here again the cuboid is fixed and the calcaneum is moving. Okay. So as the calcaneum moves at the subtalar joint during weight bearing activities, so it must meet some intra-articular demands of the opposing saddle shaped surfaces in the calcaneo-cuboid joint, which results in twisting movements, motion. So the twisting motion occurs in calcaneo-cuboid joint. The calcaneo-cuboid articulation itself is having a bone capsule, and this one is reinforced by many ligaments. Now we will see the ligaments of the calcaneo-cuboid joint. Yes. Here we can find the capsule which is reinforced medially. So this one is medially. The capsule of this calcaneo-cuboid joint on the medial aspect, which is reinforced by the lateral band of the bifurcate ligament, also known as calcaneo-cuboid ligament. And if you see dorsally, it is supported by the dorsal calcaneo-cuboid ligament, and inferiorly, that means on the plantar aspect, which is supported by plantar calcaneo cuboid ligament. This plantar calcaneo cuboid ligament is having short and long plantar ligaments. So the long plantar ligament is the most important of these ligaments because the inferiorly located long plantar ligament spans distally to the bases, not only spans between the calcaneum and cuboid, but it also continues distally on the basis of the second, third, fourth metatarsals. So this long plantar ligament which also extend on the plantar side, okay, on the plantar side. So I am showing on the dorsal aspect, but on the plantar side this plantar ligament is going to continue distally at the basis of the second, third and fourth metatarsal. So therefore the long plantar ligament provides support to the transverse tarsal arch. So that means this ligament not only provides support to the transverse tarsal arch as well as the lateral longitudinal arch of the foot. Lateral longitudinal arch of the foot. Okay, and the extrinsic muscles of the foot also provide important support for the transverse tarsal joint as they pass medially, okay, as they pass medially, okay, and then laterally, medially, laterally as well as inferiorly to the joint. So this is all about the calcaneo-cuboid joint. In the next session we are going to discuss about the transverse tarsal joint function. Thank you.